Okay, great. Hi, everybody. Thanks for joining us today. I'm just getting the agenda pulled up here. 1 second.
Hi, Tom, I'm here.
Awesome. Hey. Okay, great. Yeah. Welcome everybody. Welcome to the July Coordinated Entry Committee meeting. As always, we'll start by grounding ourselves in our theory of change, that if we create a homelessness response system that centers the voices of people with lived experience of homelessness, then we can focus on responding to needs and eliminating inequities to end homelessness. I'm going to pass it to Catherine to call the roll today.
Thanks, Tom. So dark in here. Devin. I see you, Devin.
Sorry, I had to find my mute button.
That's okay.
I'm here, present. Thanks.
Noah.
Present.
Eddie.
Present.
We're all having issues this morning. Martha. Not yet. Portia.
Present.
Dr. Sam. Elliot.
I see Elliot in the attendees, Catherine, but I don't know if I'm a co-host, and so I don't know if I'm able to promote folks from attendee status to panelist.
Okay. You want to try?
When I click on the ... next to someone's name, all it gives me the option to is report them, and I certainly don't want to report Elliot.
Catherine, it's
No.
you that has to do it. You're the only one who has those.
Okay, Elliot, you should be joining us now. Can you hear us, Elliot? Right.
Hello.
Hello.
Hey.
Sorry about that little technical difficulty.
No worries. Appreciate you guys.
Okay, and Kelsey is not joining us. Jaja, I see you.
Yeah, present.
Sherry Tillman. Ben.
Present.
And Mustafa.
Present.
Okay. You have 8 members present. And 4 absent. You have met quorum.
Wonderful. Awesome. Hey, everybody. It's great to see you again. Hope the summer is moving along well for you all. And today, I think we're just going to jump right into it. The first thing that I wanted to talk with you all about today is that finally, after much time, it's been like a couple of years, we have some like coordinated entry system performance data to look at. And so really the first thing that I wanted to do on our agenda today is to jump right in and start to talk about that. Catherine, I'm going to send you a request to make me a co-host so that I can share my screen.
Got it.
Huzzah. I think I'm good to go now. Yeah. Great. Is everyone seeing this presentation? Awesome.
Yes.
So this is our 2024 coordinated entry system performance data. And so for a little bit of background, our policies and procedures say that the CE process will be monitored and reported on quarterly and annually to ensure that it is operating effectively. Clearly, that's something, and it goes on to say in this paragraph that this committee is the body that we are the coordinating entity, presenting this data to. And so that's all part of how it sets forth in our policies and procedures for us that continuous system improvement and quality improvement is done with the coordinated entry system. Obviously, that is something that has not been happening over the last quarter to quarter here with this committee. So I'm really excited to start this exercise and sharing this all with you. This is something that, our team worked really hard on in partnership with our research and data team, our HMIS team, to prepare and bring. And so a little bit of background of how we got here. We needed to kind of adapt the framework and the metrics of how coordinated entry had been measured in the past. The sources that we looked to kind of adapt the framework from was from previous evaluations of the coordinated entry system. The last one that had taken place was in 2021. And it really was almost kind of put out and published almost as reading like a scholarly article with kind of an abstract and an introduction and then kind of a method section with findings. And then there was also the metrics that we would share on the coordinated entry data dashboard, which is available on our website, but has not been updated since 2022. And part of the reason for that is because in that time, 2022 to today, there have been some pretty major shifts in how the coordinated entry system operates. So if you look at the coordinated entry system performance data on our website, actually, here I am. I'm gonna, for the purposes of this presentation, actually be switching back and forth from a slideshow to my internet browser. So let me make sure first that I'm actually sharing my screen in a way that's going to support that. Sorry, I didn't do that before. Entire screen. All right, that's what I want. Screen 2. Great. I'm a visual person, so I like to be able to, here we go, to actually look at things when I'm talking about them. So, if you look at this is our coordinated entry website. And then if you go to look at the data that we have, I think some of you, if not all of you, are familiar with this. There's some outdated stuff on here, starting with even just this kind of process map of how the system works. There's outdated information here, that's no longer relevant to how our system, functions. When we're talking about prioritization with this table, this was taken for granted or incorporating that coordinated entries using a priority pool, which we no longer do, right? So we had to kind of adapt the framework and the metrics that we were using to kind of even know what we wanted to measure and to talk about what we wanted to measure. And so we've been working on that with our research and data team really over the last year to develop and adapt. So back to our presentation. We adapted the metrics. What we wanted to look at were, in the past, we would call it who was assessed in coordinated entry. And now, what you'll see when I'm about to show you, we're going to be talking about kind of who is enrolled. You cannot take for granted all the time, for those of you familiar with the workflow, that someone who is enrolled in the coordinated entry system program. When I was a coordinated entry assessor in 2017, there was no coordinated entry system program. To enroll someone in coordinated entry, truly, you must have had to assess them. But now, the way that we track and measure coordinated entry in HMIS, there's actually we're tracking it on the program level and not just say the assessment level, right? So we wanted to adapt that to say who is enrolled in coordinated entry. We wanted to look at the timeline. How long are things taking in the coordinated entry process? We wanted to look at denials. Why are people getting denied from programs? How many people are getting denied from programs? All that kind of stuff. And then we wanted to see enrollments, who actually is enrolling in the programs. So I'll glaze over this quickly because I've already chatted about it. The last comprehensive evaluation was 2021. We have this system performance data on our dashboard. That has not been updated since 2022. we knew that it was time. We needed to get this data out to you all. You all have been asking for it. The CoC board's been asking for it. You know, we know that it's something that is, the ball is in our court to deliver and bring to the community. So it's important. So now actually really is where we're gonna kind of get into like the meat and potatoes of the actual presentation. And again, for this, I'm gonna just go to our like program that we use to generate these data displays, because it's a little more interactive for me to be able to talk with you all about. So bear with me for a sec. And this, ooh. And this is our data dashboard. And so like what we have here is we see that, and this is for the calendar year of 2024, January 2024, January 1st, 2024 to December 31st. That there were 6,906 newly assessed or newly assessed households. And for the purposes of this, like we're saying that like people who are enrolled in the CESP. And then 3,892 that were nominated to a resource. So like engaging with our Teams, Microsoft Teams case conferencing system and Smartsheet, you know, like getting nominated to a resource through our Smartsheet system. Jaja, I see your hand. Is
I
it
just
okay?
wanted to ask you what the acronym CEFP.
Coordinated Entry System Program.
Oh, CECB. Okay. Thank you. I just heard
Yeah.
wrong.
Here, I'll put that in the. CESP, Coordinated Entry System Program. And this is the program on HMIS that like, if you're asking if someone's enrolled in coordinated entry or not, like that's the program that you're gonna see. If you go to that person's like profile, they'll be enrolled in that as a program, which is something, it's a newer feature. It's a feature within the last maybe 3 or 4 years of coordinated entry. Something that was not a feature, for example, when I was actually a housing navigator. So something that's kind of changed in the last few years. 1,936 households that were referred to a resource. And then of this 1,936, 1,287. And so I think you all as a committee, for those of you who've been on the committee, Mustafa and Finn, I know you're newer to the committee, but I think are familiar with this kind of like funnel. I know that like in the past, Beth, when she was facilitating this committee, would present like figures kind of similar to this, using this funnel. I don't love talking about the funnel because I think that while it's real and like these are like real statistics and figures about our system, I think there's a lot of nuanced context that is easily like misunderstood through talking about this. And so I think a couple of important things that I like to highlight when I'm talking about this with folks is I actually really like to start here because this is an important number, this 1,287, because that means that from January 2024 to December 31st, 2024, there were 1,287 units of housing available in the coordinated entry system, and coordinated entry sent a referral to every single one of those. And so, you know, it's like to any resource that was available, like we were connecting with a warm handoff and a referral in HMIS. We sent almost 2,000 of those referrals, right? Let's call it 2,000, 1936. And almost 1,300 of those 2,000 actually enrolled in the program. So we'll have some displays to kind of break that out when we get to like the denial section. But I think that those are two figures that are really important to focus on. I also think like here, the thing that I focus on with this is that this just points to what we all know about our community about like the scarcity of resources and then also the need for resources. So we see that there were 7,000 people who approached a regional access point, an outreach team, a day center, a shelter, who were saying like, I need housing, please, I'm eligible. for coordinated entry, please enroll me. I would like to like explore my housing options through coordinated entry. Also, if it's okay, I see like Eddie, I saw your hand. I'm seeing some activity in the chat. I'm gonna have on our agenda, I have like a whole time for like discussion and questions. So I have, you know, giving myself some time for the presentation, then we have a good chunk of time for discussion and questions. So if it's okay, I want to be mindful and let you all know that I'm tracking the questions in the chat, but I might not be able to answer them in real time. And I think what could be best for this presentation is if we just like hold them to the end, if that's all right. So then we kind of get into the demographics, you know, who are these folks who are flowing through the system, who are, you know, enrolled in CE, get nominated to resources, end up getting a resource, and then that referral works out and they actually move into the household. Are households referred and nominated? Yes, these are unique households, Devin. So looking at like who the households are. So we have some demographic data here too. I think this is a similar type of like figure that you all have been showed in the past by like my predecessors. This is for everyone in HMIS. So not just those enrolled in coordinated entry. So this is like the breakdown. Then these are those who are enrolled in coordinated entry, who is nominated to a resource, who's referred to a resource and enrolled. So these kind of demographic metrics mirror the kind of like access funnel we kind of talk about up here. And some interesting things that pop out to me is that like, this is for all populations. This is like all households. If we break this out by subpopulation, we can do like families with children. We see that those demographics shift pretty substantially. You know, substantially fewer white families with children, substantially more Black or African American identifying households. The figures change for kind of like multiracial households as well. Actually, excuse me, not that much. That one stays pretty similar, but we see like some changes with AIAN and those who identify as Asian or Asian American as well. So we see some different figures here. And then we also see that moving through from like enrolling, like getting an HMIS profile and touching a front door, you might say, and then actually like getting enrolled in a housing resource, that again, there's like parity. We do have decent like parity between, like we're not seeing a substantial, you know, inequity between like households who are touching a front door and then those getting housed. Like we see some parity there. And we see largely the same for youth and young adults, that, you know, there's slightly more white youth who are engaging with the system than like families. But then when we kind of look at, and more like multiracial youth, excuse me, that was the one that where there's more of a substantial change. But then when we go to individuals, it again kind of is different too. So we are seeing that there's a different kind of racial demographic and breakup between like taking this as like all populations and then breaking it down to families, youth, and single adults. So those were some like kind of notable things that stuck out to me. Other ways that we can look at this too is looking at age. So I'm going to make sure that this is toggled all. So for all subpopulation types, we're seeing kind of like plurality, you know, some real plurality within like the bands of age in those who are like engaging with HMIS and our front doors. The vast majority between 25 to 44, and then but we still see like you know, a significant percentage of 45-54 and then 55 to 64. We're not seeing as many people 65 or above. And we're not seeing, and there's 16% under 25. So there is a really big, you know, age range. touching our HMIS, not only our HMIS system, but also coordinated entry. So that's telling us that most of the folks are in this kind of 25 to 44 age group, but there are folks who are 65 and above, 5%, and 13% who are engaging with coordinated entry that are under 25. When we look at veterans, 6% of the households in 2024 that engaged with HMIS were veterans, and 11% of those households, or 11% of the households who enrolled in coordinated entry were veterans as well. So, again, there's this element touching our system too, and veterans coordinated entry. Gender, and so of course, when we have questions about gender, this too is rooted in the fact that like these are the gender identities that are like available as drop downs for folks to select in our HMIS system. I also think too, commonly known fact that usually people of like minoritized or oppressed gender identities tend to like underreport that minoritized or oppressed gender status. So I think kind of like a strong consideration to take in mind when looking at these figures. But we do see that according to these data in 2024, that 50%, 56% of the folks enrolling or like touching our HMIS system identified as male, and 41% female, and 3% as non-cisgender. And then 1% kind of unknown, maybe choosing not to disclose or just, opting not to give any type of response there. And so similar thing here too. So from race to also like gender, we're seeing that the proportions are staying relatively similar. 44% of the households that get enrolled in coordinated entry identify in 2024 identified as female. 43% of the households that enrolled in a resource through coordinated entry in 2024 identified as female. So we're seeing that kind of parity moving through the different phases. Families with children, of course, many more families with children, the heads of households, were identifying as female, who are accessing about 80%, and 20% identifying as male, and then far fewer reporting either, a non-cisgendered gender identity or refusing or not, choosing to respond. And then still like this parity here where we're seeing the folks who ended up enrolling in a household about 80% and 20%. If we look at chronic homelessness, another thing too, data for this, as we can see in 2024, is tough. I think that to me, like anecdotally, it is a little bit surprising to see that like only 10% of the households that were accessing the coordinated entry system were chronically homeless. I feel like to me, this is maybe something that there's, challenges or data challenges or reporting challenges with kind of like documenting chronic homelessness status, like through HMIS to kind of display this data. Cause I think that, I don't know what, actually, and this would be something too, to kind of like look at our PIT count to compare like this kind of.
Tom, I don't mean to interrupt you, but do you realize that you're just showing us family with children and not all?
Oh, thank you, Jaja.
Mhm.
Ah. Thank you. Okay, so that looks different. Yeah. So about 50% of the households who are active in HMIS, all household categories are chronically homeless, and 52% that they're not. And so as we can see with all households, when they're enrolling in a resource, that's when we're getting closer to like a 60-40 split. And like we have some missing data here too, but there, Jaja, thank you so much for pointing that out. I apologize about that. Then, of course, if you look at families with children, far fewer are tracking in the system as chronically homeless. For individual adults, I think this is also kind of like unsurprising to me too, that those who are enrolling in the single adult resources very heavily favoring those who are chronically homeless because more of those resources have those chronic homeless requirements. I think we see what's interesting with youth is we see a little bit more missing data on their homelessness status, and then fewer who are chronically homeless, which I think also tracks with the experience that our providers are having, which is that it can be difficult for youth to be eligible for permanent supportive housing programs that require chronic homelessness. It's just more difficult for youth to like meet that chronic homelessness status because you need time. You know, it's either like a consistent year, a contiguous year of living in a place not meant for human habitation or a shelter, or that episodic, which is episodes over a 3-year span. So that makes sense. So these are some data really, you know, about like who is enrolling in coordinated entry and who is getting prioritized and then placed into resources through coordinated entry. The next big piece of this is like the timeline. And so I think the important things to consider here with this is that these data are displayed in medians, not in means or averages. So this is the median number of days. So this is truly just like the value that's in the middle of what the data set is, and not the most commonly occurring number, which would be the average, right? So that is something to take into consideration. However, for data sets that usually tend to have like a strong skew, the median is a reliable way of reporting kind of like what is this kind of like middle figure. And so that's why we've selected this median figure. So for median time, and what these different boxes mean is that from when someone walks through the door at a RAP site or an emergency shelter or outreach team, what have you, and is enrolled in coordinated entry and gets their housing triage tool and housing needs form completed, to the time when they were first getting nominated in our like Smartsheet Teams digital case conferencing space, the median time for that in 2024 was 14 days. So about 2 weeks. The median time it took from when someone who was going to receive a referral and get connected to a resource, from when they got that resource through tie-breaking process and then were connected to the housing provider with a warm handoff by our team, was 1 day. So our team, that like daily case conferencing churn we have, where it's like we're posting units every single day and sending warm handoffs. What we're seeing from that is that like we are getting those warm handoffs out in 1 day, and so therefore, you know, reducing the amount of time that it's taking where units are kind of like, you know, staying online and not being connected to a resource. So that was 1 day. The median number of days from the warm handoff, coordinated entry facilitated referral to someone, and this figure is for like a successful move-in. So this is like someone who moved into the program, they got their documentation submitted, they were able to make the appointments to meet with the housing provider and sign their lease and get their keys and move in the door. The median time that took in 2024 was 37 days. And so we have this also displayed by project type. So for the few emergency shelter beds, the median time it took from referral to move in was 13 days. Permanent housing with services, so there's a small number of units in coordinated entry that are just permanent housing with services, not necessarily permanent supportive housing. That's kind of adhering to those like SAMHSA minimum guidelines of what PSH is. For PSH, it's a little bit shorter, 38 days. Rapid rehousing is 56 days. This one was interesting to me, that this time was a little bit longer. some of the safe haven programs, 13, et cetera, transitional 18 days. Services only would be like navigation programs, housing navigation programs. One thing that I want to also kind of echo with this too is that our team is also tracking this data, not just, yeah, Eddie, we can filter this by population. I don't have a toggle to do that right now on this like actual like display, but that could be possible. I can do that. I can ask for that. And then the other thing too is another way that we are and can look at this data is not just by program type, but also by provider. And so we can like look at these data by provider and saying like, how long is it taking from when coordinated entry is sending a referral to where someone's moving in? And that data is something that we're looking at and kind of like using to roll out some quality control measures, like with some of the plans we have on our work plan right now, with really like supporting the case conferencing space. Like the goal is not to be punitive, right? The goal is to kind of say like, where are the teams who are, like needing support and training, and maybe also are having a lot of questions about like, how does this whole coordinated entry thing work? Like I literally just got off a call this morning talking with a provider about like, I've had assessors on my team for 2 years now, but we're really still kind of like trying to get into the swing of how we even engage with this system. So we're wanting to look at these data to say like, who are the teams that are really doing a great job and kind of are the most active and successful at getting their folks housed through coordinated entry, and like what are how are they engaging with the system, and are there things that are like replicable and teachable for other elements of the community to be able to get in touch with, and then who are the teams that are maybe having like more difficult times with this, and we need to kind of get arms around for community capacity and support building. When we look at our denials data, something I think that stuck out to me is actually look at our data from a couple years ago in 2022. We see like how many enrollments, and we can see how many coordinated entry facilitated versus external fills. And then you can also on enrollments. Oh, excuse me. It's in the referrals tab. So all the referrals that coordinated entry made versus like external fills, and then the number of referrals that resulted in a denial. And so my understanding is that this figure is for just the referrals that coordinated entry facilitated. Although I'm not honestly 100% sure on that, because the people who generated this data no longer work with me. So I wasn't able to honestly get like an answer of kind of like those who like truly generated this table, kind of like, is this figure incorporating both coordinated entry facilitated referrals and external fill, or just coordinated entry facilitated? I believe it's just coordinated entry facilitated. And you can see that 47% of the referrals that coordinated entry facilitated ended up being accepted. At the time that this snapshot was taken, there were 5% of them that were still pending, and then 48 were denied.
Hey, Tom, I think that's a pretty safe assumption, because I mean, I was around when we did external fills, and the referral function in HMIS was not used for external
Right.
fills.
Okay, perfect. So that would make sense, Eddie. Thank you. Context clues. I love it. Context clues from people who have been around and know how this is all working. So thank you so much. And now when we look, so these are all, of course, coordinated entry facilitated referrals, because there is no possibility to do external fills anymore. And 60% of them were successful and 40% were denied. To me, although that figure is still an improvement over this, I mean, let's take for granted that these 5% of pending are all 100% going to work out. So best case scenario is we have a 52-48 split And it probably wasn't going to be, it was probably gonna be closer to like a 50-50 split. Like I would have been surprised if 100% of these 5% of pending referrals all actually like turned into a program enrollment. But now we see that the split's more like 60-40 successful and denied. Let's see. We can look at these by demographic as well. So we have a lot of missing data on denials. And this is chronic status. So let's do this. We have a lot of missing chronic data status. So like we have race and ethnicity status for denials. So like here are these figures, 34% of AI/AN, all pops, 40% Black or African American, or excuse me, Asian American, 39% Black or African American. A lot of unknown data. Half of this data set is just unknown, demographic data based on the denial. And then 40% of the denials are white households. The reasons, client refused, unable to connect with client. This one means that there's like a drop-down option in HMIS that is available to providers to select, but is actually not one that results in like a piece of data that our team can actually use. It's like erroneous balance of state. That's what BOS stands for. So some questions for myself to kind of go back with our research and data team and be like, can we talk about why this says that? Can we like troubleshoot a way, to make that more clear in our HMIS system? Denied by property manager. And then some folks, hey, this is like the best denial reason that can exist. They don't need the housing resource because they have self-resolved their instance of homelessness and are already housed. And then we have some that were full capacity or no availability. So these are the denial data. And then we go from denials to enrollments. And so these are by project type. So these are the number of enrollments. And for both, I remember the thing I wanted to say, for both enrollments and denials, the key figure to remember here too is like this 1287 figure and the 1936. So, there were 1,936 unique households that were like referred to a resource. Some of those, and then 1,235 or whatever it was that were enrolled. And so like people have asked in the chat kind of like, are those unique households or like, are those the number of referrals? And so those numbers are for like the actual number of unique households that were like referred to a resource. When we're looking at the denial data, it's like someone who enrolled in a resource could have been denied from multiple resources or even the same resource once before actually enrolling. And so there's like a little bit of a kind of like difference between looking at like the percentage breakdown of denials, because here you can see that there were 2,839 referrals, right? So that number is higher than the number of unique households that were referred. So just something to keep in mind there. And then these are the enrollments. So the takeaways here are like the most ubiquitous resource we have available to folks through coordinated entry is permanent supportive housing. There were 643 referrals to permanent supportive housing in 2024. So that means that there were 643 openings at permanent supportive housing in 2024, 356 with rapid rehousing, and like the drop off goes with each kind of like project type. So 183 referrals for transitional housing and only 39 referrals to, entry exit emergency shelter. So the emergency shelter programs we have. Again, like this permanent housing with services, those are some of those programs that aren't necessarily PSH, but have a, project-based voucher or some sort of durable subsidy associated with them, that have kind of like very light touch support case management services. They have a homeless requirement, but not necessarily always a disability requirement. One thing actually that I wanted to also share with you all that I thought was important to look at is, so when we go back to, and then I'm gonna show this and then I will open it. We're at 10:40. Excuse me, I'm like 2 minutes behind schedule here, 3 minutes, but then we'll kind of open it for questions and discussion. So, when we're looking at this like demographic, like access and demographic funnel, it's always curious to me to kind of see like who's accessing the system by demographic for all populations, race and ethnicity. 36% of the households are white, 30% identifies Black, African American, or African, and then 13% as multiracial, 4% AIAN. Well, if we look at our PIT data from 2024, also PIT happened in 2024. You saw that 44% of the households experiencing homelessness in King County were white. Households in King County in general who make up the population is 55% of the population. So there's a lower representation of white folks in King County who are homeless than proportioned to the general population. And for basically any other type of racial identity that is not white, it is an overrepresentation, right? So only 7% of the households in King County identify as Black, African, or African American. And in 2024, they represented 15% of the homeless population. Multiracial, they represented 16% while only representing 7% of the King County population. AIAN, they only represent 1% of the population in King County, but represent 6% of the homeless population. So if we go back and look at coordinated entry, we're seeing like 30, so a lower number of white households as represented of those like experiencing homelessness in King County, and a strong showing from like minoritized or oppressed non-white communities experiencing homelessness who are who are like touching the front doors of the coordinated entry system and also like enrolling and being placed in the coordinated entry system. So that is one thing that the data is showing us that I thought was important to highlight. I think that there's still lots of work and lots of ground to cover in terms of equity for like coordinated entry and for homelessness in general. And also, what we saw, these data for 2024 shows us that, we know that there's an overrepresentation of non-white households experiencing homelessness in King County, and they are engaging with our system. So with that, I'll pause. I'm going to keep sharing the screen, but I do want to open it to like questions and comments, and we have time now to just have a discussion about this data. I got to say my spiel with it all, and now want to open the floor and open the mic to you all too. So I'll start to peek at the chat, but feel free to raise your hand and bring up any questions.
And Tom, real quick, could we please approve the June meeting minutes before the meeting ends today? We don't
Yes,
need to do
absolutely.
it right now because
Okay.
this is a good discussion, but just before
Yep.
the meeting ends.
Yes, thank you, Catherine.
Thank you.
Yep, and thank you. I'm just checking the chat here to see. So our households referred unduplicated. Yes, so those are just, like I said, unique unique households. Finn says, wondering how chronic homelessness was determined for this section. Yeah, Finn, you know what? I actually don't have the answer to that question right now. But it is a really good one and one that I can check in and ask. I can speculate. I think either it would probably either be like a field that's being caught in somewhere in like enrollment data or like assessment data, or aggregating from kind of like the reports that are able to be run in HMIS, that through like someone's kind of like program history, like whether or not they would meet the definition of chronic homelessness. That's my speculative answer. But I will write that question down and ask, and I can get an answer for this group. Eddie, I see that you asked a question a couple minutes ago about a certain page having a filter by population. Did I already get to that?
Yeah, it was in there. It was mainly just to like confirm that we were looking at the right data again. Sorry, I wasn't trying to like call you out because
No.
we were looking at just families on one, and then when you popped over to this, I was just wanting to confirm if this
Yeah.
page had a filter on it or not, and we were looking at the correct stuff.
This one's for whole system. I think you were asking about the timeline, right? Was it the timeline data?
Yeah, it was when you were on this page, but I know the previous page had that filter on it, and so I was just trying to like make sure that this one didn't have a filter that maybe we hadn't seen yet, type of a thing. That was turned on. So, but you're good. You're good.
Great. Yeah. I can't imagine that I, answered or satisfied everyone's inquiring minds, with questions or, so yeah, truly like any questions, comments, or even if, comments kind of like, is there anything that was kind of more surprising to folks? Is there anything that's still kind of confusing or opaque to folks that, we can kind of talk about, all ears.
I mean, I would be curious to see what the average numbers are up above for like, enrollment to move in and all of those things. Cause I think median, totally understand your explanation for that, but I think seeing the average compared to the median would be useful to see
Yeah.
how long folks are actually doing this.
Yes. Yeah, Finn, I think so. That's a great question. I think too, like we can do that, like of course, if that's something that you all want to see, then we can absolutely be able to generate that. And I think unsurprisingly to like you and others too, is that like definitely numbers like here, like this kind of like assessment to first nomination, or if you were to do like assessment to referral, for example, are going to be like potentially thousands of days. And the reason for that is because, as we know, there are folks who like enroll in coordinated entry, and if they're not connected to like a housing navigation team, might not ever be case conferenced and like nominated to a resource. And then also too, there are folks who like are getting nominated every single day by their teams, and because of like our prioritization schema being primarily rooted in the length of time in someone's current homelessness episode, are just like not getting prioritized for a resource. And for me, I think something important to think about there is how like, yes, that has to do with like prioritization, and we know that our prioritization methods are like woeful and leave a lot to be desired for like the community. And that was also a true experience for like VI SPDAT era too, where if someone's VI SPDAT score was 8, they were never going to be on the priority pool for like resources. So I think it's like, yes, I think there is value in kind of seeing what those data are, but actual kind of like true value for starting to talk about like who are the households who like are, and it all goes back to, again, to sound like a broken record, like resource scarcity, where like we just don't have the number of resources, like to go to here. There are 7,000 households who are approaching a front door of the coordinated entry system saying like, I am experiencing homelessness and I would like, and have a disability and I would like to get connected to housing, and only like 1,200 or 1,300 resources available. So like naturally there are going to be, like, if we are looking at average timeline data, if that metric never changes, then we're forever going to be in a situation where there are going to be people who are going to enroll in the system and just like never ever get connected to a resource because there just straight up aren't any available. And I know that I'm preaching to the choir when I say that, but I think it is important to note. Noah.
Yeah, thanks for this overview. I would be really interested, and you said as much too, Tom, on the denial data, trying to understand that in a more nuanced way at a system level. We've done a ton of internal work with our own units at DESC to try to understand when referrals don't make it into the unit. And one thing I've noticed, just the term and a phrase denial, I think might not. I've used the term attrition because we're seeing a high percentage of issues where people are just kind of lost to follow up. So the referrals, they're not actually denying. We're not denying, nor is the client denying the referral. They're just not being connected with it. So I think that's an important distinction, I think, in terms of both how we think about our system and what's actually happening. And then I would be fascinated to know, all those examples about denied by property manager just kind of glares at me on the page there. Because if we're running housing first systems, that number should be much lower to me. And I wonder, so that's clearly different than the number right above it, which is ineligible, which unfortunately is a reality related to different fund sources. So that's called out separately, which is alarming to me. So a lot I would like to try to unpack and do some help with any sort of quality assessment, QAQI work on this. If that's something that the team is interested in, I would love to support that.
Yeah, thanks, Noah. I appreciate the offer and the conversation too, because I think it's so important to talk about, and it's after we have this conversation, the next thing on the agenda was to talk about kind of the like focus group that the committee wanted to convene last month to talk about, piloting an assessment for folks. And it's like, to me, I see a couple things like paralleling there. Like we had that conversation with, not all of you, but some of you were there and present for the conversation. And in the conversation, we talked about, assessments and like data in HMIS and data in coordinated entry, like all these onerous and arduous requests to staff people for like, oh my gosh, another assessment. Oh my gosh, something else that I need to go. I have like my case notes and everything that I need to do in my organization's database for my job. Like I need to do my job, and then I need to document for my employer that I'm doing my job. And then I need to document for KCRHA that I'm doing my job. And I think that, like Noah, yes, like the attrition, and just kind of like all the reasons why like folks might not actually end up enrolling in a project. And then like data quality, like the eternal, like an ever present with us question of data quality in HMIS of like, how do we, our teams, can work with our system administrators at BitFocus to say, how can we get better quality of data for these denials? And oftentimes, like some of those ideas involve more clicking and like more requirements for people's staff. So I think kind of like having as much kind of like fresh, like, and like open ideas to like how we can kind of overcome some of those hurdles and get some like better quality data here so we can really look into. And I think too, like the big thing, the low hanging fruit that sticks out to me of like, working on denials is, I think, slowing down like the way that this kind of like that the scarcity mindset of coordinated entry and now like the pace of our system encourages this kind of like, oh my gosh, I have a caseload of 27 people, you know, some of them are document ready. They told me that an apartment was available today at, you know, in Pioneer Square or in Belltown or on the east side or in West Seattle, and it's the only one that's available, and I want to get this person housed. And then the person, like, we hear about this all the time, that the person shows up to the project and is saying like, I've never been here before, you know, like, yes, I want housing, but like my case manager kind of like nominated me to this place because it was the one that was available. And this isn't actually where I want to live, you know, and it's kind of like, well, we can do better by that type of situation. I also think too, kind of like the community capacity building and the infrastructure we have around like housing navigation work and getting folks kind of like document ready for filling out their housing applications. I know like our partners do their best to be as kind of like low barrier as possible with things like the homelessness requirements, ID requirements, or like social security number requirements and all that kind of stuff. And like, as you know, again, preaching to the choir, and like those are all real. And I think that those are a huge hurdle and barrier sometimes for like that we hear from our housing navigator folks being kind of like, it's difficult to work, particularly those more in the outreach space where they're like, I see some of my folks 2 times a month. And once we're able to make that appointment to get the photo ID or to go to the Social Security Administration and get that like printout, you know, verifying my income and disability status, it gets lost. They don't want me to hang on to it in my office. They want to keep it, you know, like all that kind of stuff. So I think that, you know, we have lots of work to do there too, in terms of like capacity building for the community around that. And we have some products, you know, some one pagers, some like community capacity and training materials that our team's working on right now to kind of more support and facilitate that for the case conferencing space, because we are the, you know, the facilitator of the case conferencing. So we kind of feel like we're on first for like providing that community capacity. Okay, well,
Tom, do you see that Devin asked a question in chat about the BOS? Erroneous
yes.
question?
Yeah, BOS, Devin, is balance of state.
Okay, thank you. I did just have a quick, I think something, I definitely agree with Noah on denials and looking more into that and want to dig into that. And I think also just the data on individual adults really stood out in the demographics there. Seems like that seems like something we need to really address. It seems like the results are, that's one of the areas where they're, yeah, we have a need to
Work to do.
work on, yeah, the overrepresentation of white households. And then I also was thinking within that too, just the fact that among unsheltered people experiencing unsheltered homelessness, that's, I think it's like almost 95% of those households are adults with no children. And so I just see like a opportunity to dig into the relationship between that data and really look at some system changes, you know, or why is that occurring and what can we do? So,
Yeah.
thanks. So this data is really, really helpful.
Good, I'm glad. Thank you. Sherry.
I put a question in the chat too, but it's kind of on the lines of what Devin was saying as well. Like, I know that we're preaching to the choir about this data that, like what is being seen, and we don't have the enough folks, to be able to maneuver through all the, single folds and families and stuff like that. But I feel like we tell, unhoused, like on our waiting list, we have 70 families per day. Some been on a list for 100 and something days that have not received shelter. And so it's like, we tell them, oh, make sure you do your CEA, you know what I'm saying? But like looking at the denials and stuff like that too, like how can we like um better support families or single folks without getting their hopes up to believe that, okay, that's another option, if that makes sense of what I'm saying.
It does, yeah, and thanks for raising it, thanks for raising your hand and saying it out loud, and I saw it in the chat too, and knew that it was an important one. This is one that an important question that I am glad you asked, because I am like wanting to have, have this conversation like with you all and like in public, like with the community too. I think that, I remember hearing like Alex talk about this too, and now, and know that it's like very real. That it truly is just kind of like part of doing this work is like there's a real grief and there is a real heartbreak, and a real trauma in a way that we are having to have this conversation where it's like, because just all because this is what it is, that there were 1,287 units of housing available in 2024, and that there were 6,906 households coming to a coordinated entry front door and saying, we are homeless and need housing, that like there are going to be 5,000 people that just are never connected to anything. And I think that and I think precisely because that reality is so tragic and heartbreaking and it becomes difficult to talk about, that it's not talked about enough. In some ways it's talked about too much, and in other ways it's not talked about it enough. I think that having a scarcity mindset leads to kind of like, our like homeless response system and like community partners like competing with each other in ways that are not necessarily helpful. And also it's real. There is an exclusive pie of like resources that are available. And this is why the department, this is why HUD is saying that they want like there to be coordinating entities. So to ensure that there is like equitable access to the resources. Part of the conversation that's been around coordinated entry since the amendments to like McKinney-Vento and the final rules came out about it in like 2012 and 2014 is you can sophisticatedly try and systemize your way out into or out of things, but you can't systemize your way out of 7,000 people who need something and only 1,300 of that something being available. And so all of that to say that our team here this last year, more than ever since I've joined the team, has been talking about what are we doing to set that expectation and reality with providers more upfront from the get-go. How are we taking the responsibility, to pass along, and then also having that responsibility be shared by our partners in the community and by leaders in the community, and hopefully even some champions in the community to say, look, it is unlikely. It is rough to say, but the truth that you all see here is that it is unlikely that you are going to be housed through coordinated entry. And when I first ever became a coordinated entry assessor, I got something from BitFocus that I needed to print out and put on my computer, telling the folks that I was engaging with that like, I'm going to do this assessment for you. I can neither promise, and more than can't even promise, I have to tell you that it's more likely than not that you will not be connected to a housing resource than be connected to one. And so that goes back to the heartbreak piece, that I think that like our system, and I truly believe this, is filled with people who want to help. And it's filled with people who want to offer that hope to people who are, in the hardest days of their lives and are really suffering and want to like offer this type of thing where like, I have this tool at my disposal. Let's see if it's going to help you. When really, as we can see, the truth is that like, statistically speaking, people are not likely to be connected to a resource through coordinated entry. And my team field these questions every day. Tom, Karina, Surya, Leah, Nicole, I'm nominating someone every day and they're not getting a resource. Why? What am I doing wrong? The truth is you might not be doing anything wrong, absolutely whatsoever. You might be doing everything right. Your person's not getting connected to a resource because there is not a resource for your person. And that's just the straight up truth. And I think talking about it in terms is kind of like forward as that feels hurt. It feels tragic and heartbreaking, but I don't think we're doing ourselves any favor by kind of not talking about it in those circumstances. So I'll cap it there, but Eddie.
Hey, yeah, and pardon me if I know Noah talked about denials and digging into those a little bit more, but I got a phone call that I had taken. But the denial numbers also like, I mean, it hurts my heart because a lot of those denials I feel are preventable denials, where the ineligible ones or the client refused ones. I mean, as somebody who straddles both sides, both as supporting
Right.
people who nominate and as a housing provider, like it breaks my heart when I have a client who comes in and says, "Oh, I didn't know that this was an SRO. My case manager didn't tell me."
Right.
Or I
Right.
didn't know that this was a cubicle. Like I'm not going to take a cubicle. Like I have my own place at the shelter right now where it's a whole room. Like, and I know that that story is not unique to us. Like I know, I mean, with Plymouth, with them having like SROs, I know they're phasing them out. But like I know that that is an issue with them too. And or oh, I didn't know that that's where this location was. And then so it's you guys, the coordinated entry team has done a lot of work around gathering as much data as possible about all of these programs and trying to get it out there. And I think as housing providers, we've done a really great job of like trying to complete that data and get you guys that data and make as much as available as possible. But it's also then lies on the onus of the case manager provider to be real with the client around what this resource is. Like that's the thing I think that where we see a lot of downfall is I mean I hear it all the time, and most of the time when I have to deny a referral, it's because of that. It's like, oh, they didn't know that X, Y, and Z about this program. It's like, well, all of those things were communicated up front. Like they were in the descriptions, they were in the spreadsheet that got sent out by coordinated entry team every day. So that information is there. And it's like, I mean, I think that's also part of the thing that we have to change is like making sure people know how to access this information, reading the information, and actually telling people the reality of what these programs are.
Yeah, Eddie, I think you're absolutely right, and I agree. And thank you for putting some like having some grace or saying like saying that our team is doing things to try and help get more information out there too. I think that you know there's still a lot of ground for us to cover and to make up with kind of like getting more information and materials out there. I also think that like while the daily cadence of case conferencing is good for like this middle piece here, that like the piece of the operation that our team holds right now, sure, we're making it happen very quickly. Like once we send the warm handoff, this is really between the housing navigator and the housing provider. And I think part of our goal with kind of like showing this data is to say like parts of the system that we are responsible for the actual operations, we're doing as quickly as we can. There's things that happen between like housing navigator and housing provider that are still part of the reason why it's like taking some time for folks to like actually move in. Sure. And also I think there are things for our team to do. The ways that we facilitate case conferencing, how we're able to get informational materials out to folks about what resources are available, to that can only be more supportive. Of course, we need the community's support with that. Like, I think the biggest thing for us right now is that we cannot share information on programs that we don't have. And so if we don't have one pagers or eligibility information about, certain PSH programs, then we're not able to share it. So sometimes collecting that can be a challenge. Jaja.
Yeah, I want to talk about, prior to what Eddie was talking about. We have 6,000 people 6,000 plus people who are seeking housing. And the bottom line is we only have 1,200 houses available. So I'm trying to get at, and I hear the heartfelt, I was waiting for housing in a homeless encampment and being told over and over, my name was up, but no, I didn't get it. My name was up, but I didn't get it. My name was up, and I'm wondering, how can our system be expanded or, I mean, the bottom line is we need more housing, right? But what other avenues are there that we can access to get that in order to expand this system and add to it, or to bring in, I mean, because if only 2,000 of 7,000 are getting housing, what are we going to do with the other 5,000? We've got to, I mean, that's going to take away some of that heartache if we can find another system, another avenue, where we can funnel more people or get more people on the team. I mean, are there other places out there that are silo that we don't know about? I'm just, I hear it. I mean, what a hard place to be in as a provider.
Mm-hmm.
To have to, and you're, upfront and personal with the person, and you're telling them, yay, you're all excited, yay, we got you nominated, yeah, you're gonna, and then well, you didn't get it. And you know how many times I heard that, and how many times I watched the face of the person delivering it to me. I wasn't the only one hurting. You know what I'm saying? And it's just seems like a really tough spot to have people in. And I believe that the coordinated entry system, I can't see where it can be improved anymore. I mean, without a little tweaks here and there, but the bottom line is housing availability. And not just availability, but not affordable, because affordable to who?
Yeah.
You know what I mean? I'm like lost.
Right.
On how we in the United States of America, or even in Seattle, which is not a poor country, a poor county,
No.
a city, you know what I'm saying? How this can just happen. I'm the lived experience, formerly you know what I'm saying? But I see it daily, and it just seems like it's getting worse. And so we have coordinated entry, and people are go get an HMIS, go sign up, go put your name. And then we have that excitement going on. And then on the other hand, I hear you saying to them, but we got to be realistic. Look, yeah, you can sign up and get your name on here, but it's more likely because of resources. And I think that's something you need to say. Because of resources, you may not make it. You know what I'm saying? So I don't know if
Yeah.
the question, it wasn't really a question. It was just like, but I'm trying to figure out what else can we do?
Yeah, I think so. One is that's why we're all here, and that's why you all are all here. And the idea behind sharing these data, and another thing too is that, so I'm sharing the data with you. I'm still on the hook with you all as my like accountability, system, where we need to report on this annually and quarterly. So, this is 2024 data. We still need to get into kind of like so far in 2025, and I should be updating you all kind of like each quarter, what is this looking like? So we continue to have this conversation. And I think that, so, and that's why, and the idea is, so we're talking about it, and then this group is saying, how can we expand access to those resources? What do we need to do? Who do we need to bring to the table? I have some ideas about, I think one of the biggest gaps we see in the coordinated entry system is we see a lot of folks who, and I know the PSH providers who are here with us, like on the committee, would agree with this, where it's like, not all 6,906 of those households need permanent supportive housing. But if we look and we see the most ubiquitous, the most available resource in coordinated entry is permanent supportive housing. So what kind of, also, the second most available resource is rapid rehousing. The way that we administer those programs in our community, they're very different types of resources. They're very different types of interventions for someone's experience of homelessness. Rapid rehousing, as it is currently administered, is made to be a very short term, like a year, maybe two, but to get up to 2 years of support, there's like amendment processes that need to happen. You need to apply for like a hardship request to say, like, I need an extension on my subsidy, my rental subsidy. It comes with light touch case management services, not really robust. They are not behavioral health case management services. They're case management services intended to help someone with their housing search. And that's really kind of it, What about for folks in the middle? Like that's a very kind of like, short-term intervention designed for folks who are yes, experiencing homelessness, but are going to be in a position where they're able to handle renting in the private market without any type of ongoing subsidy support, financial support, and also like behavioral health or services support too. And then you have like the most, and sometimes it feels weird to talk about it this way, but frankly, like expensive intervention for folks because it's infused with so many services like behavioral health supports at like permanent supportive housing, right? What about like for folks who aren't necessarily going to be able to re-enter the workforce and rent either a room or an apartment on their own with rapid rehousing in 6 to 18 months, but also don't need permanent supportive housing? So they would need a tenant-based voucher, but we don't have any of those through the coordinated entry system, and so it's like, how are we expanding the resources that we have available? I think those are the types of conversations that I would like to explore with this group. How do we use, that's why we want to, construct this type of committee that brings in different partners from the communities, so that we can go to our other partners in the community, like at the public housing authorities or, homeless. There are homeless, we know from the homeless inventory count that's done in conjunction with the point of time count, that there are units of permanent housing or even permanent supportive housing or people experiencing homelessness that don't go through coordinated entry, So how are we kind of continuing to kind of like not only expand the resources available, but like if the idea is for this to be a front door to like housing, then how do we actually make it be a front door to housing? Because then that conversation becomes, well, the intention of this system is so that it's a front door to housing, but not all kinds. If you need a tenant-based voucher, there's this other front door. If you need housing with supports that doesn't go through CE, there are these other front doors that are these wait lists. Like, that's all kind of part of this work that I see this kind of committee doing too. I can't make any promises on what types of goals we can accomplish there. I'm more kind of like in it with you, as I look to you all as like my partners and supports, and saying like, how can we come together to advocate to our partners in the homeless response system who don't necessarily work as closely or offer their resources through CE? That's all kind of part of what we're wanting to do here. And then I really think too, is to back to that point, Jaja, that I just made about like being honest with the reality. I think that, I have a bias, like I'm on the coordinated entry, I lead the coordinated entry team. I know I can control what I can control for my part of the system, which is administering the system and kind of talking with providers about, please, if we don't want to get folks' hopes up, then please don't get their hopes up, and let's not do that, but I can only control, elements of communication coming out from the coordinated entry team on that. Once the narrative and that conversation gets with providers, that becomes kind of bigger than what my team can control. And we do the best that we can of, with our office hours and one-off conversations with providers about like, well, then maybe you shouldn't tell the folks you're working with every single day that you're nominating them for a resource every single day and they're getting denied every day. I mean, I know that gets into, there's conversations to be had there about transparency and kind of like trauma-informed care, and like what actually is trauma-informed and what's not, and like what is ethical and what is transparent to share and not. I mean, like, I would say that like sharing that you're nominating someone every single day and then that person hearing that they're getting denied every single day, I don't necessarily know what good that does for either the provider or for the person. Is that really the most trauma-informed way to like engage with our folks, or is it actually more trauma-informed to kind of say, this is a process and, I'm engaging with the process to the best of my ability. It's also real that there are people that never get housed through this system. And so let's keep talking about the other avenues, the other ways that we can look for housing, too. So, Sherry, I want to take your question, and then I kind of imagined that we would talk about this for a little bit longer than just till 11, but I do want to be respectful of your all's time, and we still have a couple of other agenda items too. So I think, yeah, Sherry, call on you, and then definitely conversation to be continued when I continue to update you all on the quarterly data. But Sherry.
Okay, this is really quick because I just thought about this and I don't know if this is like in our power, but I know that a lot of people that receive grants from KCRHA on filling beds don't follow always the rules on that, which leaves it open to sometimes not having available beds that that are available, but they're not recording accurately, if that makes sense. And I don't know if that relies with you, but I was just thinking like, I feel like there's no accountability to saying that, like, so for example, all of the providers of the King County that are partnership that receive fundings go through our intake line, but there's a few of them that doesn't, right? And so it's like, but you have people calling in for those particular shelters, but they don't. And I know it's kind of getting off, but I'm just thinking like that's one way of helping, at least for shelter too, as well, like holding people accountable to the grants that they're received, to make sure that they're doing what they're supposed to do. And that's it, because I know that sort of time. And I know
Yeah,
that's another
Sherry.
conversation.
No, I know. I mean, what you're saying, I think, is music to like my and our team's ears, and I think that that's one of the things that's hard, right? Because you know we understand sometimes the real challenges that come through like working with us to kind of have these resources go through CE, and you're right that it is kind of like, well, hey, if this is what our community has agreed on, that like this is gonna be kind of like how we are doing this, to not participate does, you're right, contribute to inequity, right? Like, then that's also not fair to other programs that are really trying hard to make sure that their beds are going through coordinated entry. And so that's the other thing too, like any support that we can get from you all in kind of working with our partners in the community who sometimes, and there's also, I understand there's reasons for why, like I said, again, training and capacity building, we know that it's real and it has to happen, and we need to get arms around our partners who are needing that support of kind of like posting the units, you know, working through the referrals, all that kind of stuff. But yeah, I think that's a great point. Okay. I'm gonna stop sharing my screen. Like I said, I think the last thing that I want to say with this is I love all the questions, the rich conversation. Another thing that I would ask you all to consider and think about is, how did this data display and presentation work for you all? I saw in the Q&A, we got some feedback from those and attendees, kind of with some feedback on the presentation. You know, I'll do my best to be even better prepared next time, maybe a little more like succinct bullet points ready to go, talking about key takeaways and that. So I appreciate the feedback. I also think too, like we are very much open to us, the coordinated entry team and the research and data team, input and feedback from you all on how you want to see measured what we are trying to show. Like, did these metrics that we shared with you, do you come away feeling like it gave you, you know, a digestible and understandable view of how to measure the kind of system performance of the coordinated entry system? Are there other ways that you could think of that you'd like to see things kind of measured and quantified? Finn, you know, you mentioned like, okay, I understand median, yes, but is it possible to even just see those average figures? That would be helpful just for grounding and understanding, you know, very much open to feedback like that too. A document that I have been kind of really trying to ground myself in and for my own edification is the like inherited framework that KCRHA has from the data and analytics team at King County. They're called PME. I forget what the acronym stands for. No, Performance Measurements and Evaluations. That's what the acronym stands for. And they have like a PDF document committed to the framework of like how they approach measuring system performance for coordinated entry. And so I think that we have some, you know, some good historical ground to kind of like stand on and work from there. But I also want this to be an ever evolving conversation with you all as my conversation partners on it. So if anyone has feedback, feel free to email me. You know, if you feel free to email the group, and we can talk about like that question too of how are we talking about what we're talking about? How are we measuring what we're talking about? Very open to talking about that. Awesome. Okay, so the next thing that I wanted to do, well, first, before I forget, Catherine, let's vote on approving the meeting minutes for last month.
Thank you, Tom. So we just need a motion.
So moved, Catherine. This is Jaja.
And Jaja, you are making a motion for,
Making a motion to approve June's minutes for the
thank you,
coordinated entry.
thank you. Do we have a second?
I'll second that.
Thank you, Eddie. And we can do a voice vote on this. All in favor of approving the June meeting minutes, say aye.
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 Any opposed? Any abstentions? Motion has been approved. Thanks, Tom.
You're welcome. Wonderful. Okay, the next thing that we had on the agenda was I wanted to update you all on the vulnerability assessment pilot focus group. So the focus group met last week, and we had a great conversation. I was very encouraged and excited by the conversation, kind of feeling like, yay, finally, we're really the commit this. I just also want to say to you all how grateful I am to all the folks on this community committee and how proud I am of the committee. You know, I think we've really done a lot of work and taken this from a long way from where we were at, say, a year ago to now, and kind of having this really feel like it's operating. I think especially today was like a big milestone too, to kind of, because this is what we're talking about today is the reason why this committee is meant to exist. We're supposed to be looking at the system performance data for coordinated entry and talking about how do we make coordinated entry more effective? How do we make it more efficient? How do we make it better for those who are participating? And to that end, this focus group met last week. We talked about the idea of a vulnerability assessment pilot and brainstormed a few different ideas. Some of those we're still in development, but what we agreed to do is meet every couple of weeks. So I already have a message out to everyone kind of asking about when we're gonna get back together, keep the momentum very high. I'm keeping it light on kind of like contextual details now for time, and then also because we talked about a lot of different elements of, you know, what is going to need to go into doing something like this and the considerations to be taking into of like subpopulation, you know, is this just for single adults? If it is just for single adults, how can we make sure that the results of any effort we take could be scalable to families and youth as well? All that kind of stuff. And so just wanting to keep the conversation moving in that direction. That's kind of like how I would kind of encapsulate, but I don't know, Martha, Sherry, you know, others who were able to be there with us last week, if there's anything you want to kind of add to the group to say from our conversation. No? Okay, cool. So yeah, so that work is moving along, and like I said, the group's going to continue to meet. 97% sure I already sent the email reaching out to you all asking for a next time meeting, and I think ball's back in my court maybe to consolidate those responses and actually schedule a meeting. But so that's what we're doing. That's where we're at. The last thing that I wanted to discuss with you all today is just kind of like the timing of the meeting. We've changed it a couple times in the last year. In our bylaws, it says that the meeting should be 90 minutes long. I believe that's how it was originally done, like even going back to when Alex kind of reconvened this a couple years ago, 10 to 11:30. There was a time when I wanted to extend it from 10 to noon. That was kind of in the era about 9 months ago when we were having trouble meeting quorum sometimes. And people were like, there was some confusion with Zoom invites. So I wanted to make sure that the meeting was 2 hours long. So that frankly, if we needed 10, 20, 30 minutes, you know, at the front end to accumulate all of the folks here to get quorum to actually have the meeting. I think now we're kind of back in an area where, you know, I know 120 minutes once a month it's an ask, you know, for you all with time. So I was gonna, you know, say I would, if you'll notice when I start creating the agendas, I think I'm just gonna start making it for 90 minutes again, 10 to 11:30. So let's just kind of focus in on that as the norm and standard for like how long the meeting will be. And I can put that in writing. Catherine and I can follow up with you all to memorialize that. But the Zoom invite should start at 10. I think we've come into like a better, like, you know, norming with this group again, that we're starting at 10 and then we'll aim to wrap up at 11:30. So that's going to be the kind of time wise going forward. But those were the only other things that I had on the agenda for today. So if there's a motion to adjourn, I think we would be ready to do so. And I just want to thank you all again for your time.
This is Jojo. I motion to adjourn.
I'll second that.
Awesome. So moved. Okay, bang. Thanks, everybody. I really
Thank
appreciate
you.
it.
Thanks, Tom. Thanks, everyone.